Hello everyone, welcome to Columbia Health Talks, Columbia Hospital, Sarjapur Road. In this session, we have Dr. Thejaswini, consultant in Women and Reproductive Health Care, Columbia Hospital, Sarjapur Road. We have received and are still receiving a lot of questions from our patients and people viewing, and I will be putting the most popular questions up to Dr. Thejaswini to answer them one by one. Dr. Thejaswini, welcome.
Hello.
Dr. Thejaswini, could you tell us about the polycystic ovary?
Polycystic ovary, I would put it as it is a new age epidemic. In our OPDs, like if there are 10 people who are waiting for us to see, 5 will be because of polycystic ovary only. And the polycystic ovary usually causes irregular menses and weight gain and acne and facial hair growth and all that. And most of the expectation of the people who come to us would be like a cure for polycystic ovary. And unfortunately, I have to tell you that there's no cure for polycystic ovary. It is something like a BP, diabetes kind of a disease. You know, it's like a chronic disease. It's not like cough, cold, and you take some medicines and then it gets cured of. But the good news is polycystic ovary can be managed by good lifestyle changes. That is the bottom line of all polycystic ovary treatments. Like the lifestyle changes in the sense like you have a good night's sleep, you maintain your weight, you have a low carbohydrate, high protein diet, de-stressed lifestyle usually puts the polycystic ovary in order. And along with that, a little bit of medical treatment usually maintains the polycystic ovary, manages the polycystic ovary beautifully. And whenever patients are taking time to have these lifestyle changes is when the treatments come in place. And when the lifestyle changes are not enough, we do a different kind of treatment. And usually the treatment depends upon what is the requirement of the patient at that particular age. Like if I have an unmarried woman who comes to me and she just wants regularization of cycles, I put her on oral contraceptive pills and then she is sorted out. But if I have a woman who is newly married, who is suffering from irregular menses, but then she wants to conceive, then the treatment becomes different. But most of the time, good lifestyle changes and a little bit of medicines usually sorts out polycystic ovary.
Thank you, Dr. Thejaswini, for highlighting the modes of treatment available for polycystic ovary disease. Over to the next most popular question. What causes infertility in women and how do we detect it?
Infertility is defined as when a healthy man and a healthy woman live with each other for one whole year, they have tried for one whole year and they have not been able to conceive. So that's the definition of infertility which is given in our books. Because I want to tell this because I have patients coming to me like, doctor, I tried for 1 month, 2 months and I'm not able to get pregnant, whereas my friend tried for 1 month and then she's pregnant. So there's some problem with me. Usually it's not, okay? We have to give nature one whole year of time to get pregnant. So when that one whole year is not happening is when we define this patient has to be having infertility and we start treating or investigating the patient. And the reasons for infertility can be many, okay? With a woman, polycystic ovaries, endometriosis, fibroids, or hormonal imbalances, all this can cause infertility, whereas in the man, that is a low sperm count, which could be because of diabetes or thyroid or a high stress lifestyle, or vices like smoking, alcohol. All these things can cause infertility. And the investigations, once we start investigating the people, like usually basic investigations will usually pick up the problems, and then once the treatment is cause dependent, what is causing the infertility, and we treat the cause, usually the infertility gets sorted off.
So how very common is infertility in our country?
Not very common though, but then yes, more common in urban pockets, because now women are looking to get pregnant only at the later age, like post 30s, because of lot of social pressures and all that. Post 30s is when the fertility rate of a woman slightly comes down. I'm not pressing the panic buttons. It slightly comes down when compared to 20s. Okay, so the age factor and the stress factor All these things are causing infertility nowadays. I think we can go to the next question.
Could you tell us a little about the causes of endometriosis and the modes of treatment?
Okay. The inner lining of the uterus is called as endometrium. It is a hormone sensitive layer. Like there are changes happening in our body every month, and once the changes happens, we bleed from our uterus. And there is a place for the menses blood to go out through a natural orifice called vagina. But just imagine a condition where there is this endometrium, this hormone sensitive layer sitting outside the uterus, and bleeding happening outside the uterus, and there is no orifice for this blood to be let out. So this is endometriosis. Endometriosis is a condition where this endometrium or the hormone sensitive layer is sitting outside the uterus. It can be on the uterus or on the fallopian tubes or on the ovaries, and it is bleeding every month. Every month when you bleed for your menses, you're bleeding there as well. And blood in the peritoneal cavity is an irritant. So body tries to wall it off, and that's how you have endometriotic cysts, scarring and all that. So the presence of this hormone sensitive layer outside the uterus is called as endometriosis.
Could you tell us about endometriosis? What is endometriosis?
Endometriosis is a condition where the inner layer of the uterus, the hormone sensitive layer, is present outside the uterus as well. It can be present on the ovaries, it can be present on the fallopian tubes, on the intestines, or on the supports of the uterus. So what if it is present there? Just imagine a condition that every month, because of the hormonal changes which happen in your body, you bleed. And if you're bleeding from the uterus, there's a natural orifice for the uterus, that is the vagina, where the menstrual fluid goes out. But if you're bleeding in the ovary or in the fallopian tube where there is no let out, the blood collects there, and that's how you get to form endometriotic cyst, the scarring, because there is some kind of swelling happening there, inflammation happening there, and that's how it damages the reproductive system basically.
So, what could be the symptoms of endometriosis?
Pain. Pain is the flag mark symptom of endometriosis. They have painful menstrual cramps, and they have kind of a chronic pelvic pain, a dragging kind of a pelvic pain in the lower abdomen. They have a pain during sex. This pain is different, okay? Usually the pain happens when at the entry point, but the pain because of endometriosis happens on deep penetration, and it causes infertility. So these are usually the symptoms of endometriosis. The pain is mainly because whenever there is bleeding happening inside, right, there is scarring happening, there is swelling happening. So all this causes very painful menstrual cramps. And again, I want to tell you that not all menstrual cramps are endometriosis. One of the symptom of endometriosis, painful menstrual cramps, because after this there are like whole lot of people starting thinking about themselves as they are having because painful menstrual cramps are very common, but this kind of menstrual cramps are like very painful, and they'll like debilitated. It reduces their quality of life. So that's how painful the endometriosis be.
Who gets endometriosis? Is it very common?
It's not very common, Dr. Jay. It's not very common. About 10% of the people, I would put it as, that's what the studies tell. But among infertility population, the incidence can go up to 25 to 50% almost. And who can get endometriosis? Anyone who has menses can get endometriosis. But there are we actually don't know what is the cause of endometriosis. Like why only 10% of the people who have menses have endometriosis and rest 90% don't have. There are a lot of theories. One theory is like they have a faulty immune system. Like even if the bleeding happens inside, in most of the people it gets cleared off by their immune system, but in some people it doesn't. So that's how it forms cysts and it's there. And another popular theory is the retrograde menstrual flow. That is when the flow is happening inside. It's not coming outside, it's happening inside. is when the endometriosis happens. Another thing is hormonal imbalance, because estrogen is one hormone which promotes endometriosis. So because of hormonal imbalance, endometriosis can happen. So there are very many theories, nothing proved as yet.
So, how quickly could it be diagnosed, and what would be the methods of preventing?
See, the diagnosis of endometriosis could be from plain history, and by an internal examination, if we are able to pick up cysts, or the imaging modalities like ultrasound and MRI, all these things can diagnose endometriosis. But the gold standard for picking up endometriosis is laparoscopy. Laparoscopy is a small surgery where we put a camera into the abdomen of the person and then look for assays like what is happening inside the abdomen, and probably we can pick up a tissue also for documenting our diagnosis like that. And during laparoscopy, you can even clear up the endometriosis, you can treat it as well.
Dr. Thejaswini, could you highlight on the treatment options available for endometriosis?
The treatment for endometriosis depends upon the age of the patient and her requirement at that particular point in her life. Like if the patient is suffering from infertility and she wants to have a child, the treatment becomes different. Probably we will be accelerating her infertility treatment to get her pregnant, because see, the bottom line of treating endometriosis is making her get as less menses as possible. Suppose a woman is not looking to get pregnant, then we put her on continuous oral contraceptive pills or hormone-laden intrauterine devices to make her get as less menses as possible. Usually endometriosis gets sorted with that. But if the woman is looking to get pregnant, then we accelerate her infertility treatment so that she gets pregnant, and obviously during pregnancy there's no menses and endometriosis usually gets sorted. But it's not like every woman who has endometriosis should take treatment to get pregnant. It is not like that. Usually mild to moderate endometriosis, the woman usually can get pregnant on their own, but for severe endometriosis, they might have to take infertility treatment to get pregnant.
What is menopause?
Menopause is a natural cessation of menses. It is a stage in life. Okay, so usually a woman attains menopause between 45 to 55 years of age, with a median of about 50 years of age. If it happens less than 40 years, we call it as premature menopause. If it happens between 40 to 45 years, we call it as early menopause. But usually between 45 to 55 years is when they attain menopause. And there is something called as perimenopause and postmenopause also. Though the woman attains menopause by between 45 to 55, the changes of menopause starts off at least 2 to 3 years earlier, or for some people it suddenly succeeds. For some people the changes starts about 2 to 3 years earlier on only, when they start having irregular menses, lighter menses or heavier menses. They start having hot flushes, insomnia, anxiety, vaginal dryness, breast soreness, and dryness of the skin, and weight gain because their metabolic rate comes down. So bone loss, all these things start off and they attain menopause, and it can continue post-menopause also.
So, what could be the way the patients present in, either in the menopausal stage or when they are going through the phase of menopause?
In our culture, like in an Indian culture, age is respected. Okay, so usually Indian women take up menopause very well. I mean, since age is respected, the psychological feeling is also like they take it as a natural stage of life, and they are usually well adjusted with the menopause. Unlike in the Western counterparts, we do see a lot of symptoms of menopause. And patients usually present with irregular menses or very heavy menses or very lighter menses. And some people do present with hot flashes and memory disturbances and all that. Hot flashes are like they have this, they start feeling hot and their face becomes flushed and they start sweating immediately. And for many of the people, it happens like once or twice a week or thrice a week, where women look at it as minor annoyance. But for some people, it can be so severe that in an hour, they start having 2 to 3 times or 4 times in an hour. So for those people, probably we might have to give some treatment like that, or else usually we ease them to sail through the menopause by some natural remedies or some counseling like that.
So is it a clinical diagnosis, or how do we diagnose menopause?
Mostly it is a clinical diagnosis. If a woman doesn't get her menses for 1 whole year, we tell that okay, you have attained your menopause. But then in case if we have to do some blood tests, we usually do blood tests like follicle stimulating hormone where it goes above 30 to diagnose menopause.
So apart from lifestyle changes which you have mentioned for the management of menopause, is there any medical treatment available for the management of menopause?
See, hormonal replacement therapy is a treatment to reduce the symptoms of menopause, but the pros and cons is again, you have to talk with your healthcare advisor, because we don't advise hormone replacement therapy if there's a family history of cancer or like that. But the non-hormonal treatment, like the herbs like black cohosh and soy and flax seeds, all these things will reduce the symptoms of menopause. Acupuncture, meditation, relaxation techniques can treat the woman's anxiety and depression which she is undergoing at this particular age. The insomnia also, by deep breathing, meditation, they can it can help them to ease the symptoms of menopause.
Thank you, Dr. Thejaswini, for guiding us through the most important queries which most of us had. Thank you very much.
Thank you.